I'm Rob Piroli of Piroli Group Developments, and I'm happy to be with you today.
Of course. Well, thank you so much for joining us. Now, Piroli Group, of course, has these three different pillars, which is construction, it is retirement homes, and it's an apartment complex. So I'd like to talk to you a little bit about how each of those pillars is being affected by coronavirus. But before we even get started, what is the situation like right now in southwestern Ontario, in Windsor, where all of this is located?
Sure. So, as you know, we're just across the river to Michigan and specifically Detroit. We're in close proximity to an epicenter in the United States. It's a very different world down here now, I'm sure much like it is in Toronto. There are 44 confirmed cases in Windsor, and it's just we're doing the best we can to follow the rules as set out by our government, and it's not an easy thing, but we're trying to do the best we can.
Of course. And luckily right now it has been a little bit slower in the Windsor area, but there is always that concern of it potentially multiplying and the numbers growing. How are you managing this on the retirement center side of things? Because I think this is a huge concern for a lot of people who have their parents or their grandparents in a retirement center. And even in the news, you've seen that in a lot of places, the spread does get even bigger there. So what are some of the I guess, guidelines or precautions that you're taking?
Sure. So with our retirement home in Leamington, we've been on total lockdown for the last 3.5 weeks. So at that time, we didn't have any reported cases down here. And so it's unfortunate but we can't let anybody's family members in to come and visit. We are doing a very good job with our staff and screening our staff, first of all, at 6 a.m. to make sure that, they don't have a fever and any symptoms, and then they can enter to work. So we're keeping everybody out of the building. That's not an essential service. And so far, so good. I do want to report that we don't have any cases, thank God, and we feel very bad for the residents not being able to see their family, but we are trying to keep them happy and engaged, just with smaller efforts although you're socially distanced, you're still part of a vibrant community within Seacliff Manor, and not necessarily having to worry about what's happening outside of those doors. So we're still playing bingo, we're still having some activities with exercise, doing arts and crafts. So to some degree, it's still almost a normal day inside the doors at Seacliff Manor.
Can they still interact with one another? Their families can't visit, but the residents themselves, are they being asked to maintain social distance, or can they still come together to these different events?
Unfortunately, we do have to social distance. So, in our dining room, we've got different seating patterns now than what we did in the past. In the other areas, let's say in hallways, going back to the rooms, they're wide hallways, but we're asking them to keep 6 feet apart throughout the whole building. And to the large degree, they are very happy that we are taking all these precautions, and they're doing really well with it.
And what resources are available to the residents, just in terms of, obviously, this is a very scary time. They might not have all the information, as they may not have so much access to technology as a lot of people on the outside do. So who can they talk to, or what strategies are being implemented there?
Sure. So our resident wellness manager has kind of started a special program to keep all of the residents informed in independent care and in our assisted living floor. So we're giving them daily updates, showing them excerpts from when the government is speaking on the television, and showing them stats from across the world. We certainly don't want them to be in the blind of what's going on around them, but we are taking it upon ourselves to keep everybody informed of what is going on around them. If they want anything special happening, we do go and contact their families But typically, for that age group, they're doing a lot of conversing on the phone, which is something that they're accustomed of doing anyways, and not necessarily on the computer, which they do as well.
Mhm. And obviously, there's been a lot of examples, not just in Canada, but around the world, where unfortunately a lot of measures aren't taken in this retirement homes, and it does become kind of like an epicenter for a lot of spread. What lessons have you learned from a lot of these news stories that are now helping your retirement home and can potentially help, the people watching back home who might be concerned about their own loved ones?
Sure. So we've learned a lot by watching the news and what has happened, in retirement homes and long-term care in Canada and abroad in Europe. So we've learned a lot from that, but we also are following guidelines that are set out for us by our HRA and ORCA, and we're really following closely what the government is asking us to do. But mainly, I think the our claim to fame is that we got started with closing the doors to the public quite soon, and we didn't wait to react. So I think we have been watching a lot of the news, and we've done well with keeping our facility clear of anybody who could have been, at risk of contracting the coronavirus. So, for instance, if we had any employees that worked at multiple homes, we had to have them choose where they wanted to work or where they would work at this time. We didn't want to have any contaminating, from one home to another. And that's another way that we have hopefully been successful in keeping the coronavirus out of our home. But minimizing risks is really what we've done a good job so far in doing, and hopefully we can keep going forward doing that.
Of course. And now let's move on to, of course, the construction side of things, sorry, because this is a big concern for Canadians as well. How is Piroli Group ensuring that these workers that obviously have to interact with each other on a day-to-day basis are being kept healthy?
So yes, Camilla, it's been a juggling act, to say at best. As you know, we have been deemed an essential service, which we're happy with, but it's strictly a juggling act on how to have social distancing taking place on a project which we currently have in Windsor. It's a 156 unit apartment building, and we're working inside. And so we've had to change the whole structure of what happens in the building and how it happens. So, for instance, on the 6th floor, we've got strictly people that are putting in fixtures in the units. And so we're following the degree and the level of finishes and restricting other subtrades from going to those floors. And so we'll have floors where there's just drywallers, floors where there's just flooring companies, and another floor where there's just electricians, and everybody's working inside a unit. So we're trying to social distance that way. We're keeping all of our surfaces clean. With shortage of masks, there are no masks available for us in construction, which I totally understand. But we're cleaning doorknobs, definitely, I would say at least hourly. We are not letting anybody in sight who's not regular there, and minimizing the threat by allowing one worker to work in his own area in a unit, which is very hard to do, because it's, one trade affects another trade. So it's a challenge, but we're trying to do the best we can to keep our people working and our subtrades working, but it has not been easy.
Of course. And you mentioned the mask situation, and you said there were no masks available for construction. Is that because they've been designated to frontline healthcare workers, or are there just none available in general right now?
Kind of both, Camilla. So we can't seem to buy masks anywhere. And then the other side is, the compelling side. Do we wear masks in construction and then take them away from the medical field? and that's a hard question there. I'm not sure of the answer, but purely for us, we've been unable to find any masks. So we're doing the best we can with hand sanitizers. We're disinfecting services, and keeping distance apart is really all we can do.
And what other measures are being made to ensure the safety of the workers in terms of, you did say that there is one person working per unit, but are there kind of sanitation laws that you're following, or anything that families at home that have husbands or parents that work in construction should be aware of? What else is being done additionally, since there are no masks, to make sure that they have a safe and a healthy workplace?
So we are spraying down each floor at night with a special type of detergent and bleach mix. We're trying to keep things sanitized, which really was not a condition that we would have to do prior to this. And we're limiting people to who we know was on the job site for the last 3 weeks. No new sub-trades are starting. So if there's any trade that has not been on site yet, they're not allowed to enter the project. So we're really trying to keep the same people that were on the project for the last 30 days, and in hopes that we're, trying to stop spread that way. But to the friends and families of the workers in construction, we are doing the best we can to keep these people safe. We certainly feel the pain, and we are doing the best we can, and it's just about keeping projects open. It's not about and safety. It's not about anything else right now. Deadlines aren't met. They're not met for when the units are available. It's unimportant, to us at this time. But as long as we're deemed an essential business, we have to do what we have to do here and stay safe. And we are doing everything that we can possibly do to keep our workers safe.
And you did mention that there were new sanitation practices being put into place that hadn't happened beforehand. I'm curious, once this is all over, are these new sanitation rules something that you will continue to do to ensure the safety of the workers? Or do you think once everything goes back to normal, it doesn't have to be as clean or as sanitary anymore?
I think this this epidemic is going to change our world a little bit. I do see us being much more careful with the clutter and or garbage that is left on site or in the interior of a building. And I do see that trying to disinfect surfaces are something that we're going to continue doing.
All right. Well, Rob, thank you so much, of course, for all these answers. Before we let you go, is there a message or anything you'd want to share with our viewers during this pandemic?
Camilla, thank you very much. I'd just like to say to everybody who is in our industry, stay strong, be safe. Let's take care of our old people, and let's also take care of our young people that are still in the workforce. And let's do the best we can with social distancing. Keep surfaces clean. Let's keep our hands clean. Let's keep distance. And I'm sure we're going to get through this.
Absolutely. Thank you, Rob.